Hi, this is Ann Klauka, and I'm here today with Dr. Sam Kazia for a heart-to-heart talk on the Real Health Network. Now, Dr. Kazia is a renowned interventional cardiologist at Crittenden Hospital, and he's here today to talk to us about a research study that Crittenden Hospital is conducting for people with high blood pressure. Now, Dr. Kazia, we're really excited to have you here today to talk to us about why it's so important to be careful about having high blood pressure.
Hypertension or high blood pressure is a silent killer. It's like hypercholesteremia or diabetes, where the patient does not really feel the symptoms, but the ramification of long-standing hypertension is quite serious, including the potential of having a stroke, heart failure, a heart attack, or kidney failure. So it's essential that we know what our blood pressure is. The blood pressure should be taken at least 2 to 3 times in different occasions at rest, so we can determine whether the patient has high blood pressure, and if it does, then some other forms of treatment needs to be implemented.
Okay, so we talked about treatment a little bit. How is high blood pressure treated?
Well, blood pressure is treated in 2 ways. Number one is behavioral modification, meaning the lifestyle behavioral modification would be exercise, diet, low salt diet specifically, weight management. These are very important to really control the blood pressure. On the other hand, medications are required. Most patients who have hypertension will require to be taken at least 2 to 3 blood pressure medications. And unfortunately, patients sometimes have a hard time with compliance with medication, or they might have side effects. So we try to work with them by having a good understanding of the need for medication, the need for evaluating blood pressure regularly, the need for proper diet, low salt, avoiding alcohol consumption in high amount, which really lead also to high blood pressure, smoking cessation. But obviously, sometimes that might not work, and there are other options available.
Okay, so when you say other options, what about research? Is there new research that's starting to come out? I think there's, or I know we were talking a little bit about a research study that is being explored at Crittenden Hospital. Now, my understanding is that this trial is evaluating an investigational device for its potential effects on lowering high blood pressure. Can anyone with high blood pressure join this trial?
Well, obviously you have to qualify, and you have to be really looked at in multiple ways. Number one, you should be really over the age of 20, less than 80 years old, and the patient should be really a person who can really consent and understand really the ramification of the study and what does that require. We need compliant patients who are willing to be followed regularly after we use the investigation device on them. This is important for our patients. I would like my patients specifically to know that the opportunity is available, and they should not hesitate to ask questions about whether they are a good candidate for such a device.
Great. Thank you so much, Dr. Kazia, for explaining all of this for us and for giving us this information and the importance of lowering high blood pressure. So, I wish you great success on this trial. And again, for all of you interested in learning more about this important trial, please call the Cardiovascular Consultants at 586-698-1200 or Mike Cribb of Crittenden Hospital at 248-652-5626, or you can go online at www.highbloodpressuretrials.com. Thank you again, Dr. Kazia, for being here and all this great information. And again, my name is Ann Klauka with the Real Health Network. Thank you for watching.
See you soon.